I'd like to introduce you to Professor Claudia Pagliari, who's the head of the Interdisciplinary Research Group on eHealth at the University of Edinburgh. And so what we kind of thought we'd do is let her begin to talk a little, and then the slides will catch up. And that way we can get started, because because it would be good to get started, wouldn't it? Okay.
I'm, as Deborah said, Claudia Pagliari. I'm from the University of Edinburgh in Scotland, and you might be wondering what I'm doing here. Sometimes I wonder that myself. But to be honest, Deborah and I have known each other for a couple of years now, and we formed a relationship sort of online through LinkedIn originally, and also met a few times and found we had a lot of common interests. And the reason is because one of the things I am most passionate about in my work in eHealth is patient privacy, and not just privacy, but actually the ethics of it. Sometimes privacy is not enough, or it's not the answer. It's the ethical use of data which I'm particularly interested in. And my own work extends not only from research uses of data, which I am going to talk about, and other sorts of uses of data in society, but also to the way in which we use new technologies in our daily lives to manage our own health and wellness. But also we're prescribed them nowadays by our doctors, things that we might want to use to make us fitter. We're increasingly being asked to get involved in clinical trials in which we have to participate through an app that maybe monitors us, so get real-time data coming through. There are all sorts of new ways in which this is happening, and I'm going to take you through a little tour of the things that I'm been working on and I'm interested in. And I'm going to try and stay clear of the European General Data Protection Directive, because that's going to be talked about later. It's a very big deal for us in Europe. It's been fought quite vehemently, particularly by the research agencies, who were anxious that it was going to completely destroy the apple cart of research. And as a consequence of that, there's been some softening of the original plans to allow certain types of bona fide secured research using anonymous data or pseudonymous data to take place. We're in business. That's great. Okay. Okay, right. Can you hear me? Good, excellent. So I'm not a lawyer, and that's quite important to announce at the beginning. And I'm not a medic either. I'm a psychologist originally, but I've worked across many different fields for a great many years, and that involves spending time with lawyers, with computer scientists, with a lot of doctors, with patients, and as social scientists. And I also work with a group in science and technology studies. So it's quite and policy researchers as well. And they all come together in this group that I manage. So that's my just opt out, really, if I get asked any difficult legal questions. So what am I going to speak about, having said that? Well, I thought what I would like to speak about are these three issues: trust, morality, and the human condition. And all of those can be boiled into data science and politics. Now that's a pretty big list, but this is actually what I'm going to talk about. Data, big data confluence, how it's all coming together: consumer surveillance and exploitation, data altruism and personal data capitalism, technological convergence, the masters of the universe, which we've heard a little bit about so far, and the global threats. I'm just going to start with big data, because that's really a very prominent area in research. It's a top of the mind of many governments around the world, and our own government included in the United Kingdom. Huge amounts of investment. But actually it's still one of these concepts which is very hard to define. If you ask different people, it's like data scientist. If you ask different people, you'll get a different answer. But I found that it really boils down to these two things. One thing is a sort of technological construct. It's all around the systems and the data and the analytics that go around it. But the other one that's very strong in the literature is a sociological construct. It's about doing good things. It's about big visions for the future. It's about understanding society. new art and science, very big, big ideals. So it's an idealistic view and not just a technological one. I'm going to begin by talking about the focus on big data for research. And I know that concerns quite a lot of you who certainly we were hearing earlier on about feelings of being exploited, about your data being passed over without you being asked. And I think that's a really important thing to discuss, because our feelings about these things are hugely critical. We're not just robots. We're humans. We think, we act, we elect politicians because of emotions, sometimes not always in the way that is necessarily based on reason. It's a very emotional matter, and I think it was really important that those emotions came up earlier. Now, there's a growing international interest in this. I'm going to try and talk about Scotland because it has some quite interesting examples for you. But there's now an international population-based data linkage research network. So countries all over the world are getting together to share their techniques for linking data together and sometimes to collaborate across countries in order to do research using linked data. Okay, this is typically a pseudonymized data that has had your name and details taken off it, but could potentially be re-identified with the right codes. And I'll just have a little caveat as well when I'm speaking about the UK, and I think this is important to add, and I've just added that having heard a couple of the last speakers really being quite emotional about this topic. And I should just say, we have a slightly different relationship with our government, and we have a slightly different relationship with our health service. Well, quite a big one. There's a lot more trust in it because it's a social enterprise. It's free at the point of care. No one ever gives you a bill. There's pretty much no restriction on anything you get. It's paid for through general taxation, and you know, it's a high level of public trust, as I've said. So it's a slightly different scenario, and I'll come back to that later. But the public sector is responsible for nearly all of our healthcare, nearly all of it, everything right from your general practitioner or family physician up to the most specialized surgeon. There's a few private healthcare services, but pretty much everything is covered by the state. And as a consequence, nearly all your health data is state health data, and it's a huge ecosystem. And it extends beyond health data as well in the sorts of work we do, which is interdisciplinary. We might need other types of data as well. And that includes things like administrative data. Some systems are even scraping up data from the tax system. That's been the hardest one to get. Educational data, social data, researchers are using these all the time. They always have done, but there are now new ways of doing it. So we have the big data. We have a lot of open government data that's supposed to be one of the most transparent, if not the most transparent country in the world. So loads of data was put online, anonymized data, aggregated data online for research. It's being used for businesses as well as for research. And there's lots and lots of small data as well, from the telehealth devices that patients are given to monitor themselves in their home or wear, and the things that people actually bring to the party themselves that they've bought. So these are all going on, these different types of data which need different solutions, and the government has invested huge amounts of money in trying to create value from data. They've invested in a large number of data centers, they call them, across the United Kingdom, which are, some of them are looking at medical data, some of them looking at administrative data. Typically those two are being brought together. Some of them are looking at urban data or social media data around the corner as well. These are included closed data, private data that you can never get hold of, so that might be used for very specific purposes, like personalized medicine, and these other types of data as well. And the advantage is, because everything's part of the same system, the data can be linked up on a person-by-person level. So if you know the code for you in the audience, and you know that that was your code when you went to the dentist, you'll know that it's the same person when you go to your optometrist or your heart surgeon, that is the same person. And this helps to connect the healthcare system for billing purposes and reimbursement purposes, but also it helps with the learning health system. But I think we face a bit of a challenge, and everything I've told you is very much the vision for these benefits of data, the benefits of research, and making sure that things don't go wrong and people aren't harmed. But there's a slight sting in the tail, and this is extracted from the European digital agenda. And two things I want to bring your attention is, one is the concept of doing everything we can for research and innovation. And the other one is about ICT-enabled benefits for society. Now, in the classic rhetoric, if you improve the wealth of your nation, you improve the health of your nation, and all of these things should go together. But sometimes they don't align terribly well. And I'd like to bring up that topic perhaps later, that this idea that you're innovating, that you're making new products, that you might have medical solutions that are, cutting edge. Is that always going to translate to a public benefit? Is it going to leave a tangible impact on the population? Could that money perhaps have been spent on something else? We're left with these challenging questions all the time. But consider the language in this field. People are constantly talking about it, particularly in Scotland, as the new oil. Our oil's about to run out. The new oil, we're going to make money. The language is around mining data. It's around harvesting, exploiting data, dealing with your data assets, digging the data gold mines. Now, these all have quite exploitative overtures. And I'm not sure it's tremendously helpful language, but it may be indicative of what's possibly behind some of this. We have a privacy dilemma. I've pinched this from a gentleman who posted his presentation on Twitter this week, and he's had some interesting correspondence also with other members who are here today around this. But I think it's fair enough to point out this very useful trade-off here, that when it comes to privacy, or privacy, we say privacy usually, there's a trade-off between the amount of detail you have in the data and its usefulness for research. So if you strip away too much information, it becomes too private, it might not be so useful, you might need more of it. And so this is a constant balance, which is why all of these methods for separating the identity of the person while keeping the identifiability of the record are so important. And I don't have time to talk about the details. I'm sure many of you who are incredibly expert at this. But it's a huge problem. And we've run into a number of very, very nasty and difficult situations which have brought the public's attention to these matters really to quite a degree of sort of fervor to some extent. The media, the newspapers reporting. And the classic example of how not to do it was something called care.data. You've probably heard of it over here. It's been covered all over the world as a sort of bad news story of data. This was extremely divisive. The government had put out information which most people discarded, thinking it was junk mail, and then proceeded to upload their data without consent onto a national database. And then, of course, it transpired later on that even those people who had found out and officially opted out still were having their data sucked onto this database. And more than that, it was being resold to private companies without a public discussion. Of course, the whole thing was shut down for some time while it got itself sorted out. There's been a lot more public consultation and it's back on the road, but still attracting huge amounts of controversy. And I'd urge you to read this paper I've just listed on the right-hand side there, which gives a very nice account of it, as does this magazine. So they're really, getting it wrong is a hugely political problem. It can set things back many years. It can be extremely costly. Scotland is about to face its own care.data. That was an English system which we sort of got off with not having in Scotland, because our health systems are different actually, although they're under the same National Health Service. Scotland is in the process of introducing, and it's undergoing pilots, a very controversial, privacy controversial system at the moment, set to come into full force this summer and being vehemently opposed. It's called the Named Person Scheme. Every family, unbeknownst to them, will be appointed with a snooping member of the public, possibly a health visitor, possibly a teacher. They won't be told who it is. They won't have a right to know who it is. That person will start to make little notes about their children. If they come in with a runny nose that hasn't been cleaned, maybe some remark might be made about that. If there's some comment about their parents not getting on, that will be put in to the record. Anything that's medical would go in there. It becomes a dossier on every family of the most personal and invasive information you could possibly imagine, much of it based on hearsay, anecdote, and bias, effectively. The people who write it will not be accountable, and the parents will never get to see the full record. They may, after some trouble, get a redacted version, but they won't get to see what's in it. So we effectively have Big Brother working in the name of child safety, and this has been sparked, obviously, by some incidents where children slipped through the net of social services and education, and their problems weren't picked up, and they were killed by their nasty parents, or somebody else in the community. But this isn't solving the problem, because in all of those cases, the children were known to social services already. So actually having a surveillance system on every family, nobody will escape this, is a real problem. It doesn't require consent. And it's being, put to the European courts, I think, at the moment. And the government is on the edge of losing its majority because of it. But I just wanted to point out that even in Western Europe, this sort of thing is going on today. Now, something else that's going on with data, which also has implications for privacy, but also, more importantly, human rights, is the use increasingly of predictive analytics for policy. And obviously, we are moving it, we're in the algorithm society now. We're able to use big data and analytics to make inferential judgments about what will happen in the future. We can look at things, we can find out what's going to happen before they've happened now, because we understand how trends work and how variables are related to one another, and what markers there are of certain events coming in the future. And this can be quite useful for things like watching out if someone's going to end up being a critical care patient in hospital because they have some event that's reported to their general practitioner, or they have a fall at home. There are calculators that can be used to look at their risk of becoming much more seriously ill, going into hospital, and of course the government doesn't like that because it's extremely expensive. So they want to keep them out and they want to intervene early. So it makes a lot of sense in many ways. But a lot of it is potentially crossing the creepy line. We're looking potentially at a social dashboarding system where the government, who of course got access to all the data, could potentially pull that all together, can start asking questions not only about populations, but also about individuals. One example I saw recently, which really raised my eyebrows, was being brought over from New Zealand, where they're very interested in who's the most expensive members of the public. So they want to be able to predict the lifetime costs of people according to their social characteristics, or whether they're an immigrant, or these sorts of things. You can imagine how potentially discriminatory that is. Now, it's all very well if it's about intervening and understanding poverty and perhaps being able to intervene and doing Head Start and health interventions that might help. But how much of it is there? How much money is there to do all of those expensive interventions, which very often don't work anyway and are not seen to be cost effective, compared to sitting in your panopticon analysing the future? I wonder. But anyway, I'm just going to put that out there, something we should be thinking about. And another thing that concerns me as someone who is involved in the ethics side of it, I should say I don't do the data analytic works. I'm the sort of watchkeeper, if you like, on some of the ethics. But I am interested in some of the science, and I don't discount it out of hand. I think some of it's very useful. But I'm very driven towards making sure it's responsible, ethical, properly governed. It's done in consultation with the public, and it has a public mandate. And if none of those things happen, then I'm afraid I would give it a thumbs down. Now, one of the problems, I think, in this field is that, as with many areas of innovation, in order to make them happen, we have to say really good things about them. We've got to have investors buying into our new product, or we've got to have the public buying into this new thing that we want to do. We've got to believe it ourselves if we want to coalesce as a group of researchers and go to the bother of getting research applications. We've got to have belief, we've got to have vision, all of that stuff I was talking about with the big data at the beginning. And one of the consequences of this, and some would say it's been engineered this way, is this shaping of impressions through the framing of statements about public benefit. And here are some, just as an example. This one is for the Administrative Data Research Network. So their catchphrase, and these are not bad people, these are all good people trying to do good things. But just consider the catchphrase: using data intelligently, creating better knowledge for a better society. Okay, so this data, if you let us have it, it's going to make your society better. Okay? How likely do you think that is to happen in the short term? Probably not that likely. So what happens if the public say, okay, well, can you give us some examples of where you've made our society better after spending how many billions? You know, oh, maybe I can't. So we need to be very careful about how we do that. We need to be very careful about actually having projects that have potential to show a demonstrable benefit that is in the social interest. And okay, maybe there would be certain types of research which would show certain health inequalities connected with social deprivation, certain area effects, particular things that might indicate something you could do about it. For example, children who have been in the social care system are much more likely to end up in crime, much less likely to do well in education. But if you intervene early, that could be improved. How do you justify spending the money on the intervention? You show them the data. So there's a good reason for some of it. But what about some of the other stuff? Finding out the educational outcomes of mothers who have postnatal depression. What about looking at the economic impact of immigrants of different races? What about some of those things maybe not so socially acceptable? And not only, sometimes they may be very interesting from a point of view of social research because people are interested in how things work, but what if a policymaker got hold of some information which came from some research which pointed out that certain people are effectively less worth society's investment than other people? We're looking at quite a bad dystopian environment. And I think we need to watch that. It's not just about what happens with the data now and how private it is and what's the risk of security breach. That kind of doesn't matter to some extent, really, that much. Because very often this is on a population level. It's about informing policies which will then change people's lives. And they might change some people's lives for the better, but they might affect some people less well. And of course, there are other schemes which are around using these data and predictive analytics actually to identify individuals who might have defrauded the government, for example. So that's a very different use of data. It becomes non-consented data, which is identifiable and is being used to address a certain problem. And I think that's another angle to it there. So these are some of the phrases, all about delivering value, benefit, financial benefit for the country, making society better, and the one I like the best is data saves lives. Data saves lives. That's become an international one now. Data saves lives. Now, I think that obviously they're trying to summarize and say that use of data responsibly in good quality research that can lead to innovation, medical innovations, may at some point in the future save someone's life. Okay? But at the moment, maybe it's slightly misleading. So how do we define public interest? That's the real problem. What is public interest? Is it interest because the economy improves and we all get to keep our jobs? Is it because our society becomes fairer and more even? Or is it because we earn more money ourselves and we've managed to get rid of all those expensive people? What is it? No one's really that sure. And what is acceptable and trustworthy to which people? And Dr. Kanazaki talked earlier about personality, and I think that is critically important here. We need to understand we're all a bit different. We all have slightly different attitudes about how our data should be used. We have different thresholds of acceptability for the data uses. Some of us shove everything on Facebook and Twitter and all the rest of it, and others will just keep everything closed to themselves. And that's our right to do that. But it makes it very difficult to find out what the public mandate is, because there is not one public. And I think this is a real challenge. And understanding the boundaries of trust and trustworthiness under different circumstances is not easy. But critically, we also have to consider not only about how the uses of our data are going to be beneficial to us or our society now, but what about those data in the future? What if we no longer trust the government that we trusted when we donated the data? It gets a bit complicated. So we need public involvement anyway to try and iron this out for democratic reasons, ethical reasons, instrumental reasons, as well as economic ones, because we won't be able to do the research that leads to the benefits if the public's not happy with it. So there's good reasons for doing public engagement research. And there's a whole load of study that, to its credit, the UK government and research funding agencies, they've funded lots and lots of work on having dialogues with the public, surveys with the public, trying to get a sense of what's acceptable and unacceptable in the uses of these data. And there are many such reports and qualitative studies out there. These are a few. The latest one was just published by the Wellcome Trust and Ipsos Mori, who obviously do a lot, Wellcome Trust do a lot of research using data and therefore co-sponsored this. And generally, there is actually, on balance, if you synthesize the results of these studies, is quite widespread buy-in to the idea that actually doing medical research using data is probably a good thing, and they would be sort of leftover assets if they weren't used appropriately. What gets people really annoyed is the threat of disclosure of their personal sensitive conditions and the idea of their commercial companies exploiting them and taking the money and running off, or some powerful people just basically just using them like guinea pigs. So provided people are happy with the terms and conditions, if you like, then I think we can proceed. But I think the difficulty is that there's a bit of a mismatch between what the public might expect in terms of those terms and conditions and what is being portrayed as their position or what is being thought to be appropriate for research. Okay, so that's the big data. That's the big data research. And I think it is probably the biggest area of activity right now, and it's something quite tangible, things that we can do things about. Certainly in Europe, we've got legislation. We can really make it happen. But outside that, there's a lot of stuff going on where data is being generated and other things are happening to change our psychology. Our relationship with technology is changing in ways that may not always have our best interests at heart. And these things need to be taken into account alongside the big data and the sort of, it's my record and I will seal it and blah, 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 blah. That's important. But what else is going on? Well, one thing is the aging population and the lack of healthcare provision for them, and therefore the move towards having more caring robots in the home. Now, this is happening. It's been driven mostly by the Koreans, who have been doing it a lot. The Japanese are quite happy with it, and it's coming to the United Kingdom and New Zealand, places like that, and over here too. You'll maybe seen Frank and the Machine, the movie about this, not that long ago. And some of them are very, very good. They're helping autistic children to communicate in ways they can't do with people who are real people, because there's a fear of those social cues. So you use a slightly artificial-looking robot, and those children can be taught social skills. That's a big tick in the box. The cute, fluffy Paro seal that goes into old people's homes, and people with dementia who haven't had a conversation for years suddenly start to stroke it, and they start to coalesce around the fluffy seal, and their quality of life improves. Fantastic. All of those things are great. And of course, there's the home-based robots. They don't all look like this. Sometimes there might be something doing your hoovering or turning the lights on and off for you. But basically, it's there. It's there for you. Now, these are all very useful, and people remember they've lost often their capacity to make judgments they previously would have made. But nonetheless, it does raise questions about their rights not only for privacy, because many of these things are watching them and sending that data elsewhere, and you might not necessarily know who it's going to. You might not know you don't know who it's going to, which makes it even worse. But it does generate issues around trust as well, and I'll mention that more in this slide from a study we did on trying to develop these humanoid embodied agents, avatar type things, for people who are depressed between when they visit their physician or their psychologist, but they might need care in between, or they might need support in between. They might be very lonely. So the idea was that you produce this virtual agent. It's a European project, and people can it can be used to elicit their moods. They can give it their personal diaries. It can take them through their exercises they have to do, and they can give the data to the clinician so that next time they see them, they can follow up with some of those issues. All very well in theory, and there were a few of these. It wasn't quite so simple in practice. But the point I want to come to is that people have a high level of trust in machines, more than you might think. And particularly when they look humanoid or they look cute, people trust them more. They want to like them. They want to disclose to them. We know from online psychotherapy or online cognitive behavior therapy that people disclose a lot. Even alcohol treatments and sexual abuse victims will talk more to a computer sometimes than to a human being. So we're giving a lot away. Now, what happens if that trust is perhaps not well placed? What happens if we start to rely on the machine more than we should? Now, in this case, we did some qualitative work with people who are potential users of these things. And some of the interesting findings were that people, even though they were told from the outset that this was only a two-dimensional robot and that it wasn't there for their safety, they nonetheless started building trust. They started talking about it anthropometric terms. They wanted the character, because they could choose it, to look like a member of their team. This was the psychologists as well as the patients. They wanted it to look like someone they could trust. They started talking about it as their friend. And they, worst of all, had a feeling that it would be there to watch over them. Now, actually, it was an algorithm. An algorithm, it might have had an alerting capacity, but it was an algorithm. It wasn't watching over them. It wasn't someone you could rely on. And I think more and more of these systems are going to be like that. Some of them will become a lot more artificially intelligent, and they will have better ways of detecting your mood and calling for help. But it does raise questions about, we're faking real life. And that's okay maybe if we have a particular use for it, and we can suspend reality like we do when we go to the movies. But what happens when we start going over that line? Are we going to disclose things that we shouldn't? Is the information private? How would it possibly be used in ways that we're not so happy with? I think these are issues of our time. And I wanted to come next to take that a little bit further into the power of feelings. And again, it was brought up a little bit earlier on, but it's something I've been looking at for some time, is how technologies and particularly how companies selling us technologies are beginning to get into the feeling thing. They are beginning to map our faces for emotion. Which is not that hard actually. These ethics and emics have been around for a long time in psychology actually. They're beginning to test how we feel about their products from the words that we say that they were able to use natural language processing to mine. They're even getting us to do it for them now by insinuating things like emojis into Twitter and into other things. So not only will they know if we've clicked the page that we've liked their product or we've looked at their product, we'll know how much we like it, whether we don't like it, but they might also know in different days whether we're happy or we're sad or we're anxious about something. And one of these other systems is delivering that mainly, but most of these companies, they're testing these reactions out at the moment. They're going to embed them. And why might they embed them? Okay, your information is important, but that's just information. That's just data, okay? Maybe the things that you say about something, they're the next level of truth, if you like. But what about the things you give away from your face? What about when you're lying to your nearest and dearest about why you were late? Oh, yeah, something happened. Some of them might be very good at picking up your facial signals, but you might be able to cover it up. That's your right to privacy. It's your right to image management. Suddenly, in the guise of something very happy, very fun, all of those emotions are coming forward. Now, what happens if all of your responses are constantly sad ones or constantly angry ones? That might begin to say a little bit about who you are. And we're getting into that territory, again, of the mapping of personality. In fact, these emojis are not that dissimilar to the sort of measures you get in a childhood test for mood disorder. You would choose your emoji, and you would be looking at your mood disorder. So it's not that far, and likewise with the facial recognition as well. So this could be saying things about your mental health when you're interacting with Twitter. That's a bit of a scary prospect. So who's got that data? Why do you think they're investing all this money in it? It might help them to tailor products to you. Okay, I'll leave that there and come on to the next one, which is the rise of the cyberhumans. Now that, again, is coming on rapidly. We probably all would like to enhance ourselves somehow. I'd quite like to get new eyes because I'm needing these glasses. There's all something that we would want. And you know, people will be tempted to go into these. And we know from some studies of students that they're all, a lot of them are illegally buying these smart drugs now to make themselves smarter, which is quite dangerous for them. But things like Ritalin, they're taking them to make them concentrate more, or some other performance-enhancing drug. That's a bit spooky, but what if they could actually implant something that no one could see and they didn't have to take every day? It just made them really smart. Some people think those are already out there. Okay, I attended a talk recently with a gentleman who was proudly telling me he'd implanted something like this in his wife's brain. And then his next slide was about how he could control a cockroach. So I was like, oh, okay. Glad I'm not married to you. And yeah, so, but I mean, it's coming. What if you didn't know someone was implanting that in your brain? So what if it was put in there for a good purpose? Like you had Parkinson's disease, you could put that in there and it could stop the tremors. That's pretty amazing. But you know, maybe something else not so. Here's a one that's it's just in the final test to market, which will give you 20/20 vision. I'm looking out for it. 20/20 vision, and you get it put on like it's like surgical contact lens. Okay, and of course we're used to these other ones here, like children with cochlear implants, very, very useful. Check this one out. This is something called the neural web. I think it's called neural lace. Neural lace. Anyone heard of neural lace? Yeah, cool, a couple of people. This is the kind of thing I don't know how you would do it actually. You get it wrapped around your brain and it connects you to the internet. Talk about the end of privacy. But some people, they really dig that. They like that, and they want that. And you can see, if you thought, wow, I'm going to know everything. I'm going to know everything. And a lot of people won't know that I know everything because they won't know that I've got my neural lace. That's kind of scary. It brings up issues around equity, trust, fairness in our society. You know, it does think about a future in which you get the sort of the haves and the have-nots have become suddenly polarized by a factor of 1 million. Really quite frightening. And the other thing that's happening, and again, I'm doing a project in this area, is the rise of what I'm calling here the virtual cyberhuman. So these other things are physical cyberhumans, because there's the bit that sticks onto you, or there might be a simulated cyberhuman, like a robot, particularly if it uses artificial intelligence, but this is virtual cyberhumans. And that's in this space which we've started to call the social machine. And there are different groups talking about the social machine at the moment. And effectively, this is still to be fully defined, but we're looking at a space in which social media and the internet allow us to reach out and collaborate with many, many people. They may allow us to distribute tasks, micro-tasks to many people, like the classic mechanical Turk that Amazon uses to get micro workers to do its work. They allow us to create new communities amongst people that we've never met and we probably never will meet in real life. They allow us to crowdsource solutions, and they're being used even successfully in healthcare to bring people together, to share their data, citizens through patients like me, for example, sharing their data to do research themselves, which maybe the medical system won't allow them to do because it's a rare disease. Or medical professionals are being crowdsourced. They're kind of available on their phone to sort of do a little bit of a classification task or something. And if enough people with enough brain power, enough training, could look at an image and classify it, chances are you're going to get a good result. So these are being used more and more. But I think one of the challenges here is that as the potential is with the algorithmic learning and the fact that these are all connected to different computers, some of which are quite sophisticated, there's going to come a time when, if you have lots of human beings interacting with a system as human beings on a system, on a platform, it's quite obvious who it is. It's people connecting through Twitter or whatever. That's all very well. But sometimes the systems are configured to start to learn those behaviors and then start to program those behaviors in. So certain things might happen in the future that used to happen with people doing them, but now happen with a computer doing them. And the idea is that it frees up your time to do other things. But actually, if you don't really understand what's human and what's not human, it creates all sorts of challenges. Because one app that one of my colleagues was working up was around getting social lives and organising dinner parties. And after a while, the human element gave way to an algorithmic element. So people were saying, "Oh yeah, oh thanks for the invitation. Yeah, I'm going to meet you at such and such a pub at such and such a time." But they were talking to a computer. How do you think we would feel after that? And I think we're moving into a world in which those sort of artificially intelligent parts of our lives we'll start to take them for granted. We'll like them, they'll help us, but they will also take away our power, and they will also potentially manipulate us. And I think we have real problems ahead of us. And if we look at what's happening now with these social softwares that rate people and rank them, the dating apps are the classic ones, swipe, you're in, you're out, that's it's reducing humanity quite a lot. Look at these. This is an art project, but there's actually a commercial app now. You can basically photograph someone and connect through social media to photographs and work out who they are just by photographing them. So if you were a stalker, you'd have a wonderful time working out who all these poor women were. Really quite worrying issues. And there's, I won't talk about the privacy paper, but I came across a privacy paper which was quite interesting recently. And as part of these social machines evolve these bots, the bots that go out and do things. And there's been quite a bit of discussion around evil bots recently. And there was a bot that was it was let loose and started becoming a foul-mouthed racist. And of course, people said afterwards, well, obviously that shows you should never rely on these things. And the producers withdrew it and changed its algorithms. But the point is, if you fall down to the lowest common denominator, there's no policing, is there? Your systems will just end up bringing all the prejudices you have, the worst, the lowest common denominator will have, and bring it into your front living room. Now, as part of that project, I've got to know a group, and I'm doing some work around ethics with this group called the Web Science Institute. And they are in charge or coordinating this thing called the Global Web Observatory. Now, that is another issue I think is really interesting when we're talking about the world, we're talking about data sharing, and we're talking about privacy. So this is a number of data centers around, it's still quite early on, data centers around the world which have harvested different sorts of data. They might have repositories of data, or they might have a data feed that's coming from a research project they've got, or they might have a license for a certain kind of social medium that they've created. Comes in, right? Other people will have their own, and then they catalog these resources, and they can potentially then say, well, you can use mine if I can use yours, or let's have a look at how these interact with one another. So they can begin to look at things like the way information cascades from one to another. And there have been a number of these social network studies, not even pre-internet, that look at how news and rumour spreads across communities. And this is much more easy to do now in these spaces potentially. This is set to grow, but I think there are big questions about what is global. Because there's only a bit of the globe with lights on, and the other part deliberately got its lights off. As part of that project, I was fortunate to be a part of a meeting to look at some crowdsourcing projects that we could potentially do in healthcare. But they showed me this amazing panopticon. I can't think of any other word for it. And these, you'll find these in probably major train stations, but also big businesses, finance houses. They're still quite new. But as a researcher, I'd never seen anything like this before, a bank of screens which could be connected up to make one picture or lots of pictures at the same time. And it was very good for visualizing things, because sometimes you can't see them all in one picture. You might want multiple displays or to look across subjects. So they were doing some work around personalized medicine. But some things were a little bit creepy. So one thing I was looking at was looking at real-time trades of bitcoins online in little pictures. It had a feed from the Bitcoin engine, whatever that is called in official Bitcoin language. And it showed little pictures, little flowers emerging. And I was conscious that I was observing social phenomena live as they were happening. I was looking at communities forming. I was looking at relationships of trust, because it's all about co-reference and curation of the trustworthiness of your bond. I think to some extent that you work out whether this is a genuine purchaser or you value the product. I don't have the full lingo, but the point was that to be in the middle of a panopticon when you're watching quite a mysterious social process happening live in pictures around you, you can see how one bud shapes up, goes off to another bud, how they connect to one another. It's really quite remarkable, and it made me realize in the future there's some people with a lot of power who are going to be sitting in those rooms, surrounded by these banks of computers, hooked up to a global web, hooked up to all sorts of data you might or might not have given your consent to use. They'll be able to look at the world, they'll be able to zero in and look at you, okay? This is coming. This technology is being very expensive, but I gather there are a lot of purchasers. And I'm going to show you it again at the end. Okay, now, but this business about who you are and who your data is, you'll all, I'm sure, have seen the adverts for direct-to-consumer genetic tests, and this is something else I've been working on recently. This is a growth market. It's only quite recently hit the United Kingdom. And these are basically selling these things like they were just great fun. And just get your genes tested. And you can get the most amazing muscles, and you'll find that problem to your weight problem, it's all in your genes. So just buy our test, spit in the thing, send it off. Or you might be able to do other things like paternity testing. That's a bit more conventional. But what myself and my colleague Jacqueline Hall looked at recently, we went through all of the companies which are marketing actively in the UK. Had a UK address or head office, or they were on the front few pages of the Google searches on Google UK. And we found about 14 companies that fitted the medical line. We weren't interested in ancestry. We are interested in that, but not for this study or anything else. So it's ones that are supposed to be medical. And we analysed all the information they were giving on the websites. We didn't order the tests. We looked at the information on the website, how they framed their marketing messages, what imagery they used, and all the details about their products and their terms of conditions. Now, the latter part we cross-referenced against the Human Genetics Commission's guidelines, which are from 2010, but they're still the best we've got. And we looked at lack of compliance, that none of them fitted those. And common problems were really poorly worded terms and conditions that really didn't explain your risks. There were tests being ordered which should have had counselling, which didn't, things like that. But the thing I'd like to bring your attention to most was the hidden messages around data and your personal data and what happens to your data. Now remember, a gene is a gene is a gene, but once it goes on a computer and it becomes data, that's you in digital form. Okay, that's your gene in digital form. Not only is it you in digital form, but it's also probably members of your family in digital form and children you might not have had yet. They've been digitized using this data. So what happens to that data? Well, many of them, they say, oh, you agree that this after you get your test results, the data will be used for research, clinical research in the interests of mankind. Are these sorts of messages, and some is just sort of some vague reference. And some of them have actually, if you read them, they say they're selling the data. They're selling the data to third parties. Now, nobody knows what the rules are for the game are after that. They could be going to a massive chain of data brokers. They might have your name on them. They are most personal and precious information. They could become even more precious in the future. And they're really a sensitive data. So we're trying to raise attention to this and put a stop to it. And I think the other point was that, the way people were reading them, our subjects, was very different from the way the terms and conditions, actually, if you dug down into what it was selling and what people thought they were buying, very, very different. So I think there's a real problem there. And this is happening it's all online sales, so it fits in with eHealth. And linked to that is this other stuff that I was reading about and keep coming across more and more of, connected with those data, but also in the big data world in Scotland. And that's this concept of data altruism. Now, this is the idea. Altruists are people that do things for other people without expecting anything in return. They want to do the right thing and do good, so they're altruists, okay? And there are lots of these systems are seeking altruists actively. The one on the bottom right is called Share, and it's an initiative in Scotland trying to not ask people for their data, but ask if they can if the NHS researchers can have access to their record for the purposes of identifying whether they're suitable for future studies, and in which cases they would be contacted and asked for consent. Okay? Potentially it could go to the next level when they are just not asked for consent, they become part of a pre-consented set of records. That is, I think, the ultimate plan for that, and there are examples like that where people have basically pre-consented. So your biobanking projects, often you're pre-consenting to uses of your data in the future. You are not being given a list of those uses because the scientists don't know what these uses are. So you're actually giving a lot of trust, but they work quite hard. So this is doing something a bit earlier. It's looking at your, saying, can we look at you as part of a pool of data? But it's relying a great deal on altruism. And there was this little thing that snuck in that really upset me a few months ago when I went to a launch meeting of it, which was, and by the way, can we have your spare blood? Okay, I thought, spare blood, okay, what does that mean? That means your genetic data. So it's being sold like it was just a byproduct, nothing, and you going for a procedure, there's spare blood just hanging around, no one can do anything, it's no good to you, let's just have it. I'm not happy, and that's still going on. And I did write an article about it, so I was a bit grumpy. Didn't make too much fuss, but I think it's the sort of thing, it was done, again, without a bad bone in their bodies. They were not thinking negative. These are not bad people, these are doctors. They care. Okay, they're not out to make a heap of money. Some of them are out to make a heap of money, let's face it. But in the UK, typically they get paid pretty well, and they're doing this because they want the kudos. But still, hugely over the creepy line. I wasn't happy. But look at these other things that are going on, and they actually actively solicit your data. So the one on the left-hand side, and it's not the only one, genes for good. Now let's get back to this messaging and labeling thing I talked about earlier. Genes for good. So you have to give your genes for good. They're crowdsourcing your genes, okay? Which could be for good. But actually, if it's the company I'm thinking of, they also sell your data. So how would you feel like that if you do something for someone as a favor, a friend in need, and you give them some money, and then you find out they've been going partying with it, and they didn't really need it after all. You'd be quite annoyed, wouldn't you? So I think that's a bit like I would feel about that. But I might be wrong. I might be misjudging them. And I'm just saying it's a possibility. It might not be the same company. The one at the top is called Open Human Org. That's quite new. And I was having a look at it. I couldn't find out too much about it, but this is around donating your data for public benefit. Now, as I said before, we are all different, and some people are much more trusting and much more altruistic. And if we've done these studies and long deliberations with consumers, many people just say, oh, you know, what the NHS has done for me, I'm happy for you to have it. It might help someone in the future. That's their view. And other people are like, no way, you're ever getting your hands on my data, and you know, that's just the end of it. And most people are somewhere in between. They say, you can have it for this, but not for that. Okay? But if you're appealing to the altruists, you know, that's a contract you run with them, but it's also potentially an exploitative relationship, which is dependent on their personality. And what happens if you then scrape information about those sorts of altruistic tendencies from their social media behavior or their web searches, and then you target them to then come and give you some more data? It could happen. I don't know. The thing that worried me mostly about the DNA testing was these ones, which is not about you, it's about your kid. So go in and figure out what, you know, is your child going to be a sportsman? And if so, what kind of sports regime should we be putting them on? And how smart are they? And are they ever going to go to university? This is setting parents up with awful expectations and stereotypes about their children, which are going to stop them progressing potentially. If the computer tells them they're never going to be a brain scientist, maybe they never will be a brain scientist. Maybe they might have been before. But more worrying than that, it takes us to this, a kind of self-selected eugenics. It's horrible. You know, only the seeds of the best will survive. And I must say, a lot of the talk around genetic improvement and that is going on at the moment is a lot like that. I'm seeing a lot. I did study a lot the eugenics movement and the nature nurture back in the day, post when it was really political. And then everyone forgot about it. And then they started saying stuff again, which is very similar. And they didn't have the history to realize what they were saying. And it's beginning to come out now. And of course, we've got these dystopian sort of movies, Gattaca, about the guy who's sort of, running away from his genetic history, and the perfect 46 when you're engineering perfect humans and what can go wrong. But the point of the matter is these tests are out there, and it's not somebody else coming to do it to you. You're doing it to yourself. You're laying it on a plate. Stereotype me for the rest of my life. I don't know. It may suit some people, but it is a worry. And when it's not clinically necessary, I think it should be watched. And I read a couple of articles about that. So there are consequences of person-centeredness. Of course, it's our mantra in healthcare. We want to connect records to make things person-centered. We want to make sure you don't have to repeat things when you go to different clinicians or auxiliary health services, because there's some kind of documentation that's shared. They know who you are. They're not going to give you the wrong drug that makes you die. They're going to try and do the right thing for you. That's very much the mantra, certainly within Europe, it's connected healthcare, and I think within the big HMOs here too. You'll have a very disaggregated healthcare system generally, as far as I can understand, but in many organizations it's like this. So, but there are consequences, and the consequences, one of the questions is who's getting the full picture, and it might not be you. So I want to return to this theme that our main keynote speaker raised around synergy and around globalization. You'll have got the picture from what I was talking about. Partnerships between companies and government are common. Government and data brokers, companies and healthcare providers and social media, researchers and companies, global superpowers and companies, global superpowers and global superpowers that might not speak to your superpower. These things are happening. They're empires being built. And one example, I have to talk about data brokers because I'm here, and I know it's your favorite subject, and I have commented on it actually in one of Adam's articles, and I have been looking into it. And again, this is a growing environment in the UK. It's not as rife as it is in the United States, much more tightly regulated. And the good news is the Information Commissioner's Office recently stepped up and said, you can't do this, send me all your information and agree to a code of conduct. I don't know what the outcome of that is. I can't find that. I think it's still a work in progress, and I'm very much looking forward to it. But I think the most interesting and important part of it is that the biggest ones are the global providers. They're the people whose names I heard earlier on here. They're everywhere. They are the data guardians of so much information about our lives. And they are also big in the UK. But the government itself is also acting as a data broker. These services I was talking about investing in, some of them are around brokerage services, mainly around looking at research data sets that you can share with other people for secondary research. They might want to reuse them, or public surveys and educational data sets that could be reused in research. So they sort of put people together with the data sets. And some of them are done only for researchers, only within bona fide institutions, and cannot be sold. There's no money, there's only a sort of cost recovery. But other organizations are actually selling data, or they're selling data derivatives, or they're selling data services, or they're selling data products. And the reason is, and I take you back to that European Commission slide at the beginning, because universities are driven not only by a public good agenda, but by a commercialization agenda. And any top professor of medicine is getting pressured to spin off a company, to make some money, to do something big and innovative. It's not about just treating care. This is almost like you make the money, you make the company, you spin off, and oh yeah, by the way, some people may be cured from cancer, possibly. You know, but I think that is an issue, and I think we are probably in a two-tier academic society in the sense that some people are doing it only for good and some people maybe have other views. But that's my political opinion, and I'm sorry if it offends anyone. So, but I think there's also some things that we sometimes perhaps, and I'm coming back to this issue of trust and who we trust and why we trust them. And a recent case is of the charitable, a big breaking news story of charities who turned out to be data brokers. A poor woman that was given 3,000 charity requests in 1 year. Her data had been bought and sold as she was a soft one. Remember I talked about altruists? Remember I talked about understanding when you're happy or sad? Understanding whether you're a giver or not a giver? She was a giver. They all loaded on her. Social data about her was being sent around, and she was lambasted. She killed herself, and it led to this big scandal about these charities, because we trust charities. They do good, don't they? Maybe not in this case. And of course, we've even got some data brokers now realizing, as many companies are beginning to realize, which is very reassuring, that ethics actually sells. Look at Apple recently. You're going to talk about that later. Ethics sells. Ethics is good. Privacy is good. You can get more customers that way if they trust you. So I think we might see a big sea change, whereas industry is going to buy into the idea of it and would pay more for those private services. Privacy as a service, ethics as a service, definitely the way to go, I think, and I'm seeing it now. So, and of course, but the thing that is also slightly uncomfortable is the government-broker relationship. Now, the UK government has contracted, guess who? Experian, as its main gateway provider to its data. So if you want to get hold of the data the government has about you, you go through Experian to get it. Okay, so they know a lot about you. So it's a bit of a cozy relationship, and I'll let you make your own judgments about that. But flipping the model are these personal information management systems and PHR, personal health records and so forth, many of which you've heard about. The idea is you give people control over their data. They can make a choice about who they share it with, or if they just want to keep it for themselves. And on top of these systems, you know, there's market reports saying you could build lots of services on top of those systems, and there's this big market. So again, this theme of commoditizing ethics is coming up. And that may be good, but of course, there's always a flip side. Now, this is the citizens not only boss. This is a system where citizens are allowed to choose who they share the data with, and they're given a means to find out who's got data about them and what their honesty levels are, what their terms of condition, and red flagged if there's a problem, right? But they can also potentially sell their data. So this raises issues. On the one hand, it's terribly empowering that not, you know, all these awful businesses who've been, you know, blood-sucking me for all these years. I can sell my own data, it's on my control. But what happens if you happen to be a poor person? You're going to be exploited for your data. Is that really fair? If you've got loads of money and you're paying all these sort of luxurious privacy as a service IT products, are you really going to want to sell your data? No. Who's going to want to sell their data? Students, people on welfare. It's not very fair. It's not a very leveling force. So whilst on the one hand it's ethical, and this company I think they've spun out of a university, and they're doing some really worthwhile work with consumers. I think they've got this wrong, or it's something that I think needs a lot more attention, this idea of personal commoditization. And one of the downsides that also worried me when I looked into it a bit more, and again, we're on a theme here, is that in order to sign up, you have to give it access to all of your social media feeds, right? And you have to fill in a questionnaire all about your personality, all about your buying preferences, and about your neighborhood. And I guess a whole bunch of other stuff that I just didn't scrape from the site. So suddenly, okay, I'm in control, and this is my way of being in control. But what happens if the company gets bought out by someone else? Who's in control of all that information now? It might not be you. So I think this is a bit of a worrying thing. And when I read some subsequent stuff spin from the CEO in a business mag, the talk was all about predicting the likelihood of buying product X and brand Y. The traditional marketing wheel is fundamentally changing to map customer journey stories and brand relationships to us as individuals. So that sounds a lot like understanding rich data, getting rich data for marketing, doesn't it? So although it says it's intimate personalization without crossing the creepy line, I thought it was a bit creepy, but I'll leave you to judge for yourself. And of course, just to wrap up, we're looking now, I've talked about governments and businesses all coming together, but corporate convergence is hugely important now. And just using one example, Google, admittedly a big one, they're buying up companies left, right, and center. So any spin-off that comes along that happens to be good or innovative, if it looks like it might make a buck in the future, or it fits in with a strategic plan, it gets bought over. The innovators are happy, they go off with their money, or they get a nice big job. Okay, so, and then the company grows and grows. Twitter's doing it, Facebook's doing. Buy, 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 buy. It's a great big sort of, like a sweetie shop. It's like a monopoly board. So you might think, well, one sector's doing this and another sector's doing that, and they don't share their data with them, but they are very often being purchased by the same mega corporations. So pretty soon they will have, Google now has DeepMind, probably the best brains in universities in data analytics, data science, have been taken to Google. Staff from the SOCIAM project, I was mentioning earlier, really smart people went to Google. Google has bought robotics companies. It's got a big medical wing. It's looking at some really cool stuff like this, which it bought from someone else, this contact lens that allows you to take blood sugar readings, so you don't need to use a diabetes monitor. It can send messages to your implanted insulin device. Very cool, but also not without issues. And there was this big scandal recently, I think, which was raised earlier in the UK in a London hospital, where Google, this great sort of messiah of data, was given access to all the patient records in this big London trust in order to ostensibly develop a kidney app. Why would you need everybody's data for that, all of it? I don't know, but DeepMind was mining it deeply. So the point is it's there. And if we think about it globally, I think we do have to think about global privacy. This is a heat map of countries by their legislation, how strong it is, and how much privacy their citizens can be expected to have. And it's hugely patchy, as you can see. And obviously, we're pretty good at it, but there's some countries in the world that don't have it, and the little warning signs show where you're pretty much not allowed to have your own privacy. And that's quite a lot of the world, isn't it? So, globally, it could be quite difficult to regulate. But I think you should also have a look at this. I haven't put them here. try and superimpose this on the Global Transparency Index, which is another index of how transparent governments are, how much open data they give out, how much e-government they are, how much they communicate with their citizens and allow their citizens to have a say in what they do. There are great maps of that. UK, is quite high on that, and I think the United States also. And there are also maps of human rights. So if you look at them all together, I think you'll get some quite interesting pictures. And it makes you also wonder, well, okay, well, given that the internet is a global phenomenon, given that companies are coming from all over the world and sharing data in clouds, where are your data? Under whose jurisdiction are your data? Now, countries are trying to get some more control. So the Europeans have got rid of the safe harbor agreement, and they tried something else. They're not happy with that. We don't know where we're going with that, and that's with the Americans. But you can imagine in some other global transactions, it's much more complicated. Where are your data? And I think linked to that is this concept of data colonialism too, which I heard the chap from who was the eHealth lead for the World Health Organization coined that phrase. And the idea that there are parts of the world in which research can be done and other sorts of innovation can be done and marketing research because they don't have any rules. And you can just go and suck up the data. It's like sort of data slavery. That's a bit of an issue. But coming back to my final slide, and I was very glad that our first speaker broke the ice on this one because I was a bit frightened to put this in. But we have got bigger problems. We have got bigger problems. As I said, not all of the internet got its lights on. Not everybody, we are opening our data to the world, but not everybody is reciprocating. We are dealing, I think, there are some big issues we need to watch out for. Dealing with superstates with low privacy, high state control and censorship, self-policing, and a poor human rights record, who are firewalled. They're engaged in state-sponsored global cyber espionage. They're not only hacking big corporates and governments, they're hacking us as well for some quite sensitive data. Okay, and you might ask those questions about why they want that sensitive data. And most importantly, a lot of it doesn't need to be hacked because we're selling it. And the obvious one is Grindr. Grindr is a gay dating app that you hover around gentlemen of your preference and it will say whether they're available. Or you can find one down the street. It's quite very, very sensitive information about people's preferences. Okay, imagine countries where homosexuality is banned. Okay? Imagine a country that would use personal information, has a history of using personal information about its citizens to shame them and have them separated from their society or put in jail. And they now have control over this. I didn't see anything in the press saying, oh my God, Grindr's gone to China. No, I didn't see anything about that in the press. Why not? I wonder. So that's one example. And the biggest AI-linked robotics company is actually heading for an acquisition right now. And there's also an important cyber pact now between China and Russia, where they will agree not to hack one another. And again, I'd just like to leave that with you. And this is the future is coming. So I also spotted a thing about a few months ago about this China score. And I think it's really important, this citizens' character score. And if you think back to where your data are going, think of all those smiley faces. Think of all that personal information that's out there about you. And think of all the hacking of giant health databases. Could possibly someone, maybe not now, but in the future, be just storing that data up for the future? Maybe not. It's just speculation. I might be wrong. But if they're character assessing their own people and getting other people to use a social machine to do that, maybe it could be coming here as well soon. And of course, nuisance sign, China's helping Russia to control the internet, latest one there. I don't know, I don't want to say too much, but I think there are concerns, and I think they're legitimate concerns. I'm very glad they were raised earlier, and I just wanted to, there's a little picture of that panopticon I showed you at the beginning. I'll let you form your own judgments. I don't know what your facial recognition software's like. So data, knowledge, algorithms, power, God. Are we creating God in data? Are we creating a kind of God? These are the deities, knowledge deities from many cultures. It's the Oracle of Delphi, which is a predictive analytics tool from ancient Greece. We've got Mr. Deming over there with his data. Potentially we are putting the master controls, the digital dashboard of our world, of our societies and of ourselves in the hands of other people. So I think, anyway, it's just worth thinking. But the good news is data ethics is on the top of the agenda. All the big boys, certainly in the UK, are playing the ethics game. There's a newly announced data science ethical framework, a Council for Data Ethics, which you've got one over here as well. So possibly we're all moving in the right direction. So I won't give you a conclusion slide. I'll just stop there. Thank you.